All right. Thank you for Dr. Borsham, for the introduction and the privilege of the podium. I'm presenting on social media, specifically program branding, resident education, applicant recruitment, and academic success thereafter. I've been here for 5 years, and I owe everything to this department. Before I start talking about social media, I'd like to share a few things about myself. I do not have any disclosures. I was born and raised in the Kingdom of Jordan. I'm an immigrant to the United States, a naturalized American citizen, and also an international medical graduate. I'm cisgender gay male and grew up to both Muslim and Christian families. I have my own set of implicit biases and opinions. The Middle East has a very, very long way to go protecting LGBTQ youth. As you can see, Jordan is right smack in the middle between all of this. And so every day I am reminded that I owe my life and career to my launching pad, Mayo, West Virginia, the state that I love, and WVU Department of Surgery, who trained me to be a competent general surgeon. On June 20th of 2016, when I was finishing up my prelim year at Mayo, we had packed our belongings. The U-Haul was packed and ready, filled with our furniture. We were moving from Minnesota to Atlanta to start a PGY2 prelim spot at Emory. I got a phone call from John Cardinal, the past program director, the next day. And he said, I have an open PGY1 categorical position for you. Will you accept it? The obvious answer for me was yes. And rather than driving from Minnesota to Atlanta, we took the U-Haul and we drove all the way from Minnesota to Morgantown, West Virginia. We arrived a few days before the beginning of the academic year, homeless. We had a U-Haul packed with furniture, nowhere to live. Enter Linda Schaefer. Huge thank you to Linda, who has been my mother really for the past 5 years here. Her support, both professionally and personally. She helped my husband find the Spanish teaching job at the local high school. And she was also very instrumental during the 5 years of my residency program. So Linda, thank you very much. March 31st of 2016 will always be the best day of my life. This is when I was naturalized and became an American citizen. The second paragraph reads, you have sworn a solemn oath to this country and you share in it its privileges and responsibilities. Our democratic principles and liberties are yours to uphold through active and engaged participation. I encourage you to be involved in your community and to promote the values that guide us as Americans: hard work and honesty, courage and fair play, tolerance, curiosity, loyalty, and patriotism. And I feel like all of these characteristics also apply to a lot of the general surgery residents here. I dedicate this privilege of the podium and this talk to my mom. Mom, I miss you every day. So why did I choose to talk about social media? My journey in life led me to seek connections and make friendships as an underrepresented minority. My personal bias of its value in surgical education. I think it caters to the next generation of learners and allows me to network with colleagues, friends, and family from all over the world. I'm not afraid of its novelty and expansion, so long as I do not break the rules. There was an article published in Surgery. Social media is a necessary practice of surgery, or a necessary component of surgery practice. And I do not agree with the results of the study. Let's not kid ourselves. There are thousands of surgeons all around the country, including within this department, who are successful and do not have any social media platforms. But so why are they not participating in social media? Is it an informed decision based on educated responses from people that they've heard information on social media for, or is it their fear of social media? Well, there has been several studies that have showed that there's a lack of experience and understanding of some of the platforms like Twitter and Facebook. And some surgeons have concerns specifically pertaining to breaches of professionalism, especially when it comes to patient confidentiality, or patients seeking medical advice outside of clinical relationships, which you should, by the way, never do, and also physicians engaging in unprofessional activities that can be broadcasted to the world, and then all of a sudden you find yourself in trouble. some surgeons just do not have time for social media. Why do I think it's important? I think it's important because millennials love social media. Who are the millennials? They are the ones born between 1980 and 2000. They represent 80 million of the United States population, or 2.5 billion worldwide. Most ethically, racially, and diverse. They grew up alongside technology and they do appreciate it. And that comes in with all of the social media platforms. By the year 2030, 75% of the world's population will be made up of millennials. These millennials aspire to make a difference with their work. They are confident, have high expectations, and they are very achievement-oriented. We do not have a study showing that medical students go on search engines like Google to find information on programs. However, there was a recent study by Telefonica of 1,000 adult millennials, which found that 57% of these millennials used search engines like Google to find information on restaurants, nightlife, or entertainment, and 50% use social media as well. And so one can only think that the same would apply for medical students who are looking at programs, Googling their names. So here's where one example comes to mind is Duke Surgery. If you were to Google Duke Surgery, their Twitter account comes up second. Notice what comes up below the Twitter result. So they have diversity and inclusion. There's kudos to one of their surgeons for being promoted. And then they also have a registration for a minimally invasive surgery course. So demonstrates leadership in surgery. They have a robust follower, about 1,300 on their Twitter account. Same thing can be applied to our program, although I will say we have more followers than the Duke Surgery program, and I'm very proud of it. It's been a few years in the making. If you look it up, it'll feature the Harriet Tubman lectureship, and if you look at the pictures, there'll be pictures of medical students training on robots, and also the department logo. If you look at some of the videos that pop up when you look up the webpage, then you'll see Kelsey and the promotional video of our program. Now, without all of this, without the online, without the Twitter account, in the past, if you looked up WVU surgery, all you would get was this. What is that? That is the backside of the loading dock. So my point here is the best defense is a good offense. Own your social media presence. If you own your social media presence, you have the ability to change the perceptions or public perceptions of the department. Why do I think Twitter is personally my favorite? I think, sorry, this is not coming up. Twitter is my favorite because it tends to be a topic rather than network-based social media platform, allows for reposting of others' content, more frequent posting compared to other media, and facilitates greater influence and a variety of content. So whether you like it or not, every department of surgery has a brand. And the brand does not just extend to interactions that we have during national meetings, between residents and faculty of others, but also our online presence. In his book, Dave Kirpin looked at social media and identified several attributes that make for a good social media presence: listening, storytelling, passion, team player, authenticity, adaptability, and gratefulness. And I think all of these apply to the general surgery resident as they practice their daily life. And so there's a very large intersection between social media and the general surgery resident and their work. Visual abstracts to disseminate research on social media, a prospective case crossover study. There are a lot of journals that are currently on Twitter. JACS is on Twitter, Annals of Surgery is on Twitter, Journal of Surgical Research is on Twitter, and tweets that included a visual abstract versus tweets of articles that had the title alone resulted in an 8-fold increase in retweets and a 3-fold increase in article visits. These are now quality metrics of an article's perceived success and impact. Believe it or not, yes, it is, and I will get to it shortly. Don't lag behind, step out of your comfort zone. The American Society of Breast Surgeons meeting between 2013 and 2016, a lot of the people that were unable to be present for the meetings were able to follow along with the abstracts that were presented just by being on Twitter, because some of these abstracts are presented in Twitter live. We had a recent publication with faculty here about the General Surgery Morbidity and Mortality Conference and how to make it better. When our paper was accepted, they asked us to create a visual abstract for dissemination on social media, which included for them mostly Twitter, but also Facebook and Instagram. It just comes to show how much even the Journal of Surgical Education is invested in social media and wants to disseminate the content. Now, this article is probably about a year old, but it has already been cited 3 times. People who come on social media, especially with academic surgery, are looking for value. Social media consumers seek value from the accounts that they follow. Educational content leads to increased engagement compared to just promotional tweets. The evolution of the journal club from Osler to Twitter. The first people to have an online journal club was with urology, and then led to the East online journal club that is often moderated by Dr. Khan, and then the University of Michigan journal club, which tends to be a very famous one. This is one of the tweets by Dr. Khan, introducing people to the East Journal Club. It allows for a lot of debate about certain topics within trauma and acute care surgery. The U Michigan Journal Club is very impressive. The Journal Club follows traditional in-person resident journal club, but is online. The article authors can serve as moderators because you're on Twitter, and if the article authors are on there, they can be present for the chat. Strengthens the residents' learning and contributes to program branding as well. Faculty and residents contribute educational content and learn from their peers. So sometimes I'm scrolling down my phone and I see, for example, the triangle of safety for placing a chest tube, or the blood supply of the bile duct tends to be at 9 and 3 o'clock marginal arteries. These are things that just pop up on my Twitter account because I'm following the Journal of Surgical Oncology, for example. One other thing that I love about Twitter is that they will present you with a case, otherwise healthy male with isolated stab wound to the left flank. They give you the vital signs. They say the CT has some inflammation and flecks of air around the colon. How would you proceed? There is a lot of discussion and engagement that includes some very well-known surgeons around the country. So some people will say for the ABS, the safest answer is to go and proceed with an XLAP and primary repair. See here another opinion with safest way is XLAP. So you tend to learn from people when you're checking your Twitter on a daily basis. This clinical trial, antibiotic therapy versus appendectomy for the treatment of uncomplicated acute appendicitis, was the impetus for a robust discussion on Twitter, discussing whether appendicitis is a surgical disease or not. It led to the generation of Behind the Knife, which is now a platform that is online, that is, I say, probably more than 50% of us listen to this podcast every day. And I think that it's hugely beneficial for AppSite and even the boards. There was also a study that showed that gamified Twitter microblogging supports resident preparation for the American Board of Surgery in-service training examination. They would tweet one question Monday through Friday at 7 a.m. It's a full learning sort of experience. Your learners seek out knowledge themselves to fulfill a perceived deficit in their understanding. And the study actually showed that participants increased their Absat percentile by an average of 14 percentile, which is significant. Another one of the things that I love about Twitter is advocacy. This is a study that was published by Northwestern University, showing the experiences of 314 LGBTQ general surgery residents, more likely to experience mistreatment. 46 responded to sexual harassment, 58 discrimination, 75% bullying. Attendings, unfortunately, were the most common source of sexual harassment, discrimination, and bullying. LGBTQ residents were just as likely to be satisfied with the decision to become a surgeon, but they were more likely to consider leaving the program and more likely to consider suicide. This should give anyone pause. This is unacceptable. And so because of that, I actually personally, I'm working with the American College of Surgeons now and setting up focus groups with not only the surgery departments, but also departments across the country to discuss with some of the LGBTQ residents who are out why this is happening. And instead of a quantitative survey, we will be doing a qualitative survey where we sit down with the resident and discuss exactly what is happening. So let's say you're interested now and you want to start your own Twitter account, or you want to start a departmental account. Let's take an example. Here's Cody Mullins. He's one of our outstanding medical students. First thing is recognizable professional photo. So if you are an applicant for the next cycle, strongly recommend that you use a professional photo if you are going to have a Twitter account. His username is professional. It's his first name and the last name. He gives a completed bio, gives you a sense of who he is. He did his MPH at Penn. He's obsessed with improvement, and he's an aspiring general surgeon. We all know that. And then he chooses photos that reflect positively on his account. Gets bonus points for his header of WVU medicine. So success starts with you. Choose the appropriate platform and begin to construct your Twitter presence. Step 2 is setting up a team. So talk to the program about setting up a department Twitter account, which we did in the past and has been a success. Administrative oversight is very important. Ensure administrative overseer understands the goals of the account, training on basic social media techniques, and solicit support from residents and researchers or those with an interest. Step 3, support residents in their tweets. Serves both the program and careers. Tweets from residents can speak for themselves. Retweeted by the departmental account. So this was tweeted by the Journal of Surgical Education. They have WVU as a hashtag, and they tagged the WVU surgery account, which again, branding through the Journal of Surgical Education. And they also featured the abstract that we had presented and was accepted for publication. So I think it's great that some of these journals are doing this. So you've created a new Twitter account, now what? So listen, live tweet, conferences, follow along with those. Join a tweet chat to do with your specialty and interests. Curate content of your own, don't just retweet and like. Be interesting, add pictures that are appropriate. Support professional societies, because a lot of them are on Twitter. Support professional journals, because again, a lot of them are on Twitter. And again, support your institution. Some basic skills to master. So it has been shown that tweets that have images are more likely to be retweeted and garner engagement. The other thing is using hashtags. So if you hashtag SAGES 2018, for example, during the meeting, it will be more easy for people to find your tweet. And again here, 21 retweets for this tweet by Heather Logue. For applicant recruitment, I think Twitter is massively successful. Department accounts should rate resident accomplishments and highlight fellowship matriculations. This is one of the ones that we created and posted on the Twitter account. It got a lot of good feedback. We showcase the uniqueness of our program through the fresh tissue training program, which is also, we've tweeted about it in the past. And then again, tag and retweet resident achievements such as poster or podium presentations for networking purposes. The name of the resident gets out there. The society sees the name of the resident. All of a sudden, the resident is now applying for the match for HPB or surgical oncology, and they know who this person is, so they may extend an interview. Many surgical departments have Twitter accounts. VCU, UT Southwestern, Wisconsin, Hopkins. I'm a little bit disappointed that they missed our Twitter account, and I was actually going to email them about this, because this actually is from an article that was just published last week. I looked through and our department account was not on there, so I have a lot of questions for them. Twitter is used to develop department brands, share photos of department events, celebrate departmental achievements, and disseminate science pioneered by faculty and residents. Our own WVU Twitter account, we've used it for the open house. This was very helpful, especially in the era of virtual interviews. Conley was tweeting about how many slots are available for open houses, and I think that this was hugely successful in recruiting some of these applicants for the match cycle. We also celebrate residents. Here is Levi and Kelsey presenting their research at the Southeastern.
That is the last conference any of us went to.
Yep, and it is the last conference anyone went to, exactly. And by the way, they're not holding hands. It looks like they're holding hands here, but they're actually not. One last thing is that the WVU surgery Twitter account can also showcase the fact that we now actually have a West Virginia chapter webpage that you can visit. The abstract portal for anyone who's interested in submitting is now open. I don't know if it's going to be in person or virtual, but this also shows leadership in surgery. We have a website of our own. We can solicit abstracts online, and we feature the Greenbrier. And I know that for sure, a lot of people from the United States don't even know of the Greenbrier or have never visited, because it's just simply a beautiful place. Twitter gives you the opportunity to join lists. So if you look for lists, you may find breast surgery, docs, anti-racism resources, and then it'll also show you some people to follow. So if you click on one of the lists, it will show you who's on the list. And then if you want to be part of that list, you can join. And if you want to follow the person that you found interesting, you can also follow them. So this is a breakdown of some of my statistics on Twitter. After a study that was published by the American College of Surgeons in JACS, where they tagged, I gained about 1,895 followers. There was more than 110% increase in mentions, and 68.5 thousand visits to my Twitter account just by JACS, which has about 200,000 followers, tweeting about the study that we had on COVID. Online dissemination is now a quality metric. So this is an old study, like local infiltration of liposomal bupivacaine. You'll see this donut, and it says the article is in the 51st percentile, ranked 106, 105 of the 236,000 tracked articles of a similar age, and it is in the 59th percentile, ranked 61st of the 167 tracked articles of a similar age in the Annals of Surgical Oncology. So if you think online dissemination of your article doesn't matter, think again. Does anybody know what this is? So this is altmetric, and this is how the social media world now tracks your article. If you look closely when you publish something, you will see this at the bottom left or bottom right corner of your article. Purple is captures, which includes bookmarks and favorites. Yellow is mentions, which includes blogs, media, posts, Wikipedia that mentioned your article. Blue is social media, so whether your article got tweeted, liked, or shared. And then orange is citations. These are the citation indices. And finally, green is usage. So clicks, number of clicks, number of downloads of a video that you uploaded with your article. And these, you can find this on any article these days that is published. This donut, you'll see again next to your publication, and each color represents a certain aspect of social media. So yellow is blogs, for example. Blue is Facebook. LinkedIn is also blue. Google is purple. And so different articles will have different donut shapes, and you'll see. There was a question: does tweeting improve citations? The one-year results from the TSSMN prospective randomized trial. This is the Thoracic Surgery Society for social media, and they compared when compared with control articles. Tweeted articles achieved significantly greater increase in the altmetric score, but also a greater change in citations at 1 year. So the ones that were tweeted were tweeted three times, plus minus 2.4, versus the ones that were not. And that's statistically significant. An independent predictor of citation was exposure to a large number of Twitter followers. And so that shows you that, again, if you publish, post it on Twitter, there's no shame in posting your article on Twitter. The reason you're doing it is because you know that it's going to get cited more. They concluded that at 1 year, this randomized trial importantly demonstrates that tweeting results in significantly more article citations over time, highlighting the durable scholarly impact of social media activity. The Journal of the American College of Surgeons published the best practices for surgeons' social media use, and the statement basically boils down to extending traditional expectations of professionalism to online behavior, content, and engagement. Anything that you think you're doing right in the hospital or you're doing wrong in the hospital, extend it to the Twitter account. And I'll go through a very easy thing. You should not be treating Twitter or any social media platform as if it was a surgeon's lounge where you can discuss anything openly. Treat it as if it's the elevator test. If you can say what you are going to tweet in a elevator that is full of people, and you would not think twice about saying it, it's likely okay. And just remember, for patient confidentiality, the bar is set very high. HIPAA is inadequate for virtual confidentiality. Just never discuss patient information at any point. Be humble. If a post offends someone and they reach out to you, apologize, acknowledge, and just amend or delete your tweet. If you think about deleting your tweet, then the chances are that you should. We're all human. Determining the level of informality, humanizing the profession, and basically how will the content posted reflect on the profession. You have to role model a healthy lifestyle and inspire the next generation of surgeons. The best example is the hashtag I look like a surgeon, which was created by Heather Loeb and created a very strong social media movement, specifically the advocating for women surgeons. Be smart, think twice, post once, know how to delete, be aware of the greater context of information available online. This is a noble and respected profession. Tweet, like all of your tweets, will go viral, because chances are one of your tweets one day will viral. And I'll take any questions at this time. Thank you.